Why don't we go ahead and get started? So welcome everybody, and thank you for joining us. Here in the left the dog days of summer, and I guess we're now in the dog days of fall. If you didn't hear me talk about it before, we're going to try to replicate the sign-in sheets we used to do with the poll. So go ahead and if you haven't already, go ahead and answer the poll that you should see on your screen. It's just 2 easy questions. You should be able to answer, know what your gender and race and ethnicity are. And this will help us when we're applying for grants because they want to know, who we serve and, what they look like. So go ahead and do that. And then on the invitation that went out, you probably saw it save the date for the reunion project. And this year we're combining forces with Desert AIDS Project because we had to postpone our event that's usually in the spring. And so we're combining their Aging Positively event and the reunion project for a day-long virtual event. So we won't be able to go to the Eisenhower. So it's all going to be on Zoom again on October 7th, which is a Saturday. And our keynote speaker will be Javier Munoz, who took the starring role in Hamilton on Broadway after Lin-Manuel Miranda stepped down, and he's a gay HIV positive cancer survivor. So he's going to talk about his story. So please sign up for that when this is a save the date. The next week or so, we'll have the Eventbrite registration page up and you can sign up. So we look forward to everybody joining us for that next month. So that's it for announcements. So without further ado, I'll introduce our speaker, Cesar Perez from Bill Hartz Insurance, and of course, Bill Hartz from Bill Hartz Insurance, who many of you have seen talk over the years. So thank you guys for coming back and telling us all about Medicare.
Thank you, Jeff. No, we appreciate the opportunity. We really value the opportunity, and so we want to give out the best information that we can. And again, thank you for the time. Will I be, so I don't know if you can see my screen now, or is there something that I have to activate in order for me to be able to share my screen with you guys?
I've activated it, so you should be able to share screen. Have you tried it yet?
Yeah, just click share
Okay,
screen.
all right. I see it. Yeah, I see it. Okay, got it. There you go. So there we go.
Yeah,
so
now we're going.
Okay, now we're on the right track. So let me just move this over. Okay, so hello everybody. Again, thank you to Jeff, and you can now see my screen, hopefully. We're gonna be going over some of the basics in Medicare. By the way, that's me in the picture. If you already saw me on the camera, but that's me in the picture. That's a couple of people that work with me here in the office. My lovely wife is to my left on your right side. And, pretty much this is me. It might be a little bit awkward. I'm used to just seeing everybody in person, but we're gonna go for it this time, see how it goes. And again, thank you. Did you want to say anything beforehand, Brian? I know we have him there. I don't know if he's, I think he's muted though, but did you want to say anything before I get started?
I will, and I appreciate that, Cesar. Just real quick, I'm sure what's going to be on the top of a lot of people's mind is what's coming up next for 2021. And we're just now, Cesar and I and our whole team, we're going through learning of what's coming. And we're actually not able to start sharing that information until after October the 1st. But this presentation here, it's very much educational in nature, and it just goes through, the different components of Medicare, and, each individual person has their own situation. And that's why we're here as brokers to really sit down with you one-on-one to analyze, really what the right option is for you. So again, thank you so much, Jeff. A good long-term relationship together. I really appreciate you allowing us to speak here tonight.
Thanks, guys. And then run the housekeeping thing. People, if you're not speaking, or ask everyone to mute their phones so we don't get any background noise from multiple people. That could become a real issue. So thank you. Great, Cesar, take it away.
Perfect. Thank you, Brian. Thank you, Jeff. So yeah, again, that's me, and my name is Cesar Perez, and my information there on the screen, I'll share that with you guys at the end of the presentation as well, if anybody has questions. And so pretty much this is today's agenda. So initially, we're gonna go ahead and do an overview of the Medicare program. After that, we'll explain some of the options when it comes to Medicare and how pretty much it works and what options you have when you are entitled to Medicare. And then after that, we'll discuss the enrollment periods of when you cannot sign up for certain plans, or you know, all the whole everything to do with enrollment periods during the year. Lastly, we'll open it up for question and answer. Hopefully, this will clarify Medicare for you a little bit, because it is a complex subject, and so I want to make sure to keep it as simple as possible. There are going to be some things that might be a little bit more complex, and then if you do have questions, absolutely please write them down. That way we don't forget them, and then at the end we can clarify them. And so pretty much the reason why we do this, here's some items. Like, for example, we are not affiliated with Social Security or Medicare directly, so I cannot sit here and say, hey, my name is Cesar and I'm from Medicare. That would be illegal. We are, Brian mentioned it in the beginning, we are brokers, and so with that comes responsibility that we have to be licensed by the California Department of Insurance to know what we're talking about, or else we wouldn't be able to educate Medicare eligible people on their plan options. We do provide different services like customer service. When somebody goes through us, usually we tell them, hey, you know what, make us your first phone call instead of having to dial the 800 number and then having to wait, you know, for hours. If you saw my picture in the beginning, there's a few other people there with me. So some of these people are the ones that help me with the service. Like, for example, if I have somebody that calls me, obviously, you know, I might be busy in an appointment, but I always want to make sure that the phone call is answered. And so that is when I say we provide our own service. You know, we're able to help resolve many common issues. For example, sometimes somebody gets a bill. It might be a bill that's a mistake, but obviously when you get a bill, you're like, hey, what in the world is this? I thought I was going to be covered. And sometimes it's just a matter of just calling and saying, hey, you know, X person got a bill, you know, what's going on? And they might just say, oh, no, it was a mistake, please disregard it. But obviously, you know, having somebody to call in that situation can save you time, and it can make things a lot easier on your part. If you have somebody that you trust that you can work with, it goes a long way. We also do this at no cost to you. Whenever we have a client that we're helping, we do not charge for our services because we are compensated by the health plans themselves, and the commissions are regulated. So it's not like, hey, we're going to sign you up to this plan because this plan pays us the most. It actually doesn't work that way. Pretty much we all, you know, they all have to pay the same amount. So being that we are brokers, we try to pretty much help. Our main concern is to make sure the person that's sitting in front of us is taken care of. With all that being said, let's go over Medicare. So when is somebody eligible for Medicare? Well, somebody's eligible for Medicare when they are turning 65, or in certain circumstances, if they are under 65, if they are deemed disabled, they will qualify for Medicare approximately 24 months after they have been deemed disabled. And that usually is like after you've been getting disability, Social Security disability for 24 months, they would generally send you your Medicare card. And then there's certain other situations. For example, if somebody develops end-stage renal disease, they would be eligible for Medicare sooner, as well as if somebody's blind. In those situations, it does not take 24 months to be eligible. It's a lot sooner that happens. And then you must be a U.S. citizen or legal resident, and you must have lived in the United States at least 5 consecutive years to be eligible for Medicare. Now, when we talk Medicare, you may or may not have already seen this card, but the card here on the slide is the new Medicare card. Back in the day, or back a couple years ago, they used to they used to issue a different Medicare card, and the Medicare number was actually the person's social security number, or if you were getting benefits under a spouse, it might have been your spouse's social security number that was on the card. It kind of took him, I think, a little bit over 30 or 40 years to figure it out that that was not a good idea. So they issued new Medicare cards, and now your Medicare number is a random series of numbers and letters. And so you can see on the card it has Part A, Part B. Some people only have Part A, some people only have Part B, some people have both, or most people should have both. But I'll go ahead and explain those parts in the next few slides. So essentially what this card gives you, so if you have Medicare Part A, generally for Medicare Part A, most people do not pay a monthly premium. The reason for that is if you have worked 40 quarters or more, which is the equivalent of 10 years or more, then you are eligible for Medicare Part A or entitled to Medicare Part A at no cost. People who do not have the 40 quarters, if you can see there under 30 quarters, you must pay a $458 per month, which is quite expensive. And then anywhere between 30 and 39 quarters, it's $252 per month that you must pay. Now, there is what we call a late enrollment penalty for Part A, which means that if you are eligible to enroll in Part A, even if you have to pay, but you don't sign up, then you will pay an additional 10% per year once you do sign up for Part A for twice the number of years that you could have been under Part A, which is kind of a tongue twister. So if you were supposed to have Medicare and it's been a year, then you're going to pay 10%, and you're going to pay that 10% additional for 2 years, right? Because it's twice the number of years that you could have had Part A. And so under Part A, the services that are covered under Part A are home health care, hospice care, hospital inpatient stays, which is not like emergency room. It's just if you are hospitalized, mental health inpatient stays, and a skilled nursing facility. Those are the benefits covered under Part A if you just had Medicare and nothing else. The main one is hospitalization. And so, for example, under Part A, you have a deductible for 2020 of $1,408. So, for example, if you're in the hospital, hospitalized 1 day or up to 60 days, you would get a bill for $1,408 as a deductible. And then after that, it's a per day amount after day 60. And then after day 91, it's also a per day amount. And so that's essentially what is covered under Medicare Part A. Now, under Part B, which is the other part of Medicare, which is the one up below that covers medical services. On that one, you have a standard premium. So regardless of whether you have a work history or not, it's $144.60. However, there are people that do pay more for Part B, and I'm going to explain that in the next couple of slides, and that's based on a person's income. However, if you don't fall over those guidelines, you only pay the $144.60 per month. Generally, you will pay that amount, and if you're receiving Social Security, they will automatically take the $144 from your Social Security. If you are not receiving Social Security, what will happen is you will get a bill, and they'll bill it every quarter. So every 3 months, you'll get a bill for 3 months at a time of the $144.60. Now, what I was talking about, if you fall over a certain income threshold, if you can see on here on this chart, it says, for example, if you file an individual return, if you make less than $87,000 a year, you only pay the $144. If you make more than that, it depends on how much more, from 87 to 109, you would pay an additional $57.80 per month, which your total would be $202.40. So you can see from the chart, and then if you're married, you get obviously it's a higher amount that you can, income-wise, that you can make before your Part B premium is adjusted. So we call it IRMA, which is Income Related Medicare Adjustment. amount. And so some people get stuck with this. Like, let's say, for example, you or one of your friends is turning 65, right? And let's say they had a second home and they sold their second home a year or two ago because they were coming down to Palm Springs. They're going to buy a home down here that's probably cheaper, and they're going to retire nicely, right? So a lot of people, they'll sell their house. And then what will happen is, like, let's say your 2018 or 19 tax returns from their their returns have a gain on capital gains, and that makes their income go up. Like, let's say, it goes up to $200,000 for that year. Well, there is a 2-year look back period in which the IRS or whenever they're tabulating your Medicare Part B payment, that they look at the 2 years tax returns. And so if they see that they're going to send you a bill, or they're going to try to bill you a higher amount. However, let's say that in this example, the person is no longer going to make those $200,000 per year, then you will have to call and let Social Security know, hey, you know what, this was a one-time income adjustment because, I sold the property or whatever the case was. But if the person is not going to make that income anymore, then it is in their best interest to let Social Security know so that they're not stuck with the higher premium payment. And that could save, a person some significant amount of money over the year. If they notify Social Security before they start deducting their Medicare Part B premiums, or before they bill them. So that's something that I always like to mention, because we have a lot of those situations come up, and I always advise people, hey, just it's a form that you fill out from Social Security, and it literally takes minutes, and it can save you a few $1,000s in the year, obviously depending on how much the income was, but certainly something helpful. That's the chart keeps going. So there is also a late enrollment penalty for Part B, and so generally, sometimes this is as the retirement age has been pushed up. So if you guys recall, a few years back, the full retirement age was 65 years of age. Now it's moved up to like 66 and a half. It's probably going to go to 67 and a half, and so on and so forth. But as people retire later, sometimes they don't go to Social Security. And before, people would go and they would tell them, hey, you got to apply for Medicare too. And so they would apply. But sometimes what happens is now you're supposed to sign up for Medicare at 65, even if you're going to hold off on retiring until you're 66. The only reason you would not apply for Part B for your Medicare is if you are employed and your employer is giving you employer-sponsored coverage. So if you're covered from your employer and they're giving you coverage that is creditable, which means that it's as good as Medicare's coverage, then that's the only reason why you could hold off and not pay a penalty. But if you don't have other coverage, you should definitely get your Part B when you're 65, or else the penalty, it's a perpetual penalty. So that one never goes away. So if, like, for example, somebody waits a year and they have to pay an extra 10%, so instead of $144, they're paying an extra 10%, which is an additional $14 a month, then, that's never going to go away. So, you're stuck paying that for the rest of your life. So it's always good to, be preemptive and to make sure that you're prepared, so you don't have to be stuck with a penalty. But that's generally how that works. Now, Part B, what's covered under Part B? Well, under Part B, you have any medical services, lab work, anything to do really with a doctor's office, and then the emergency room also falls under Part B. Under Part B, you have a deductible of $198 for the calendar year. Once you satisfy that deductible, you are supposed to pay 20% thereafter. And so 20%, it can be 20% of, what the Medicare allowed amount is for certain services. So, it can add up quickly, and there's no cap to that. So, you know, that's what scares people. The 20%, they say, well, what's 20% of what? Well, you know, it really depends on the services. Now, there is another part to Medicare, which is Part D, which is not on the card. Part D stands for drugs, so medications. Under Part D, I'm going to attempt to explain it in a way that makes sense in the next slide. But essentially, Part D, you're supposed to purchase from a private insurance company. And the way Part D works, the structure of Part D has to be pretty much it's the same with every company. So the basic structure is the same. They can offer benefits that are better than the basic structure, but essentially the way Medicare Part D works is the following way. So generally under Part D, you're going to have an annual deductible of $435. If you see the top of the slide, $435. So every plan, there are plans that are going to waive that deductible because they can do that. They can, you know, if it's better than the standard amount, then the plan can offer it. So there's going to be plans that are going to charge you a $435 calendar year deductible. Once the person satisfies that $435 deductible, then they go into what we call the initial coverage stage. So think of the initial coverage stage. Think of that as if you see it says up to $4,020. That's the amount the insurance company is going to pay on your behalf for medications. So think of it as having a credit card with a $4,020 limit on there. Now let's just pretend that you're taking an expensive medication, and let's just pretend that your copayment on that medication is $40 when you go into the pharmacy. But let's just say the full price of that medication is $500. So every time you go in and you refill a medication, you are only going to pay your copay, which is $40 when you're in the initial coverage stage. But you actually think of it as if you're swiping that card with the $4,000 limit for the full $500. Well, what's going to happen after a few months of you swiping that card for those $500? What's going to happen to your $4,000? Well, obviously that's going to deplete the $4,000, right? So once you deplete your $4,020 initial coverage allowance, you're going to fall into what's called the donut hole. I'm not sure if any of you have heard of the donut hole, but being in the donut hole is not a good thing. And so they also call it the coverage gap. And so when you exhaust your $4,020, then you go into the coverage gap. In the coverage gap, you go from paying your copayment. So in our example, our copayment was $40. So, and our full price was $500. So you go from paying your $40 copayment to paying 25% of the full cost of the drug. So you go from paying $40, and then all of a sudden you go to the pharmacy, and then the pharmacist say, well, now it's $125. So you're standing there and you're like, what is going on? Well, hit your donut hole up. The pharmacist is probably not gonna know what to say, but they're just gonna say, that's what I see on the computer, talk to your insurance company, right? So when you're in the donut hole, you're paying 25%, 70% is comprised. The other 70% of the price of the medication is usually you get a discount by the drug manufacturer, and then the remaining 5% of the cost is covered by the insurance company. Now, to get out of the donut hole, the amount that you paid during your initial coverage stage and your deductible, like the $40, and then if you had a $435 deductible, that adds up, plus the full price of the drug during your donut hole adds up, and all those amounts have to reach $6,350 in order for you to come out of the donut hole. Once you come out of the donut hole, your price goes back down to 5% of the cost, or $8.95, whichever is greater. In our example, let's just say it goes back down to 5%. So you're going from paying, in the beginning, you're paying your $40 copay, then you go up to your $125, which is 25% of 500, and then 5% of 500. I believe that is $25. So you go back to paying $25, right? In our example. So that's how Part D works, and it works the same way with every plan. The only difference is the plans, when you are on a Part D plan, they can tinker with the deductible, and then sometimes they will also offer what we call coverage through the gap, which even if you hit your donut hole, you would still be covered in those situations. But I know it's not very, it's not the simplest concept to understand. I always ask myself, who in the world came up with the Part D coverage? You know, they couldn't have made it simpler, right?
People that don't use it came up with it.
I'm sorry?
People that don't use it came up with it.
Yeah, oh, exactly. Under Part D, you have different terms. Like, for example, we have a drug formulary. So every company has a drug formulary, which is a list of drugs, and each plan can decide to put the list of drugs. If you see on the bottom, it's called tiered formulary. So there's different tiers. Depending on which tier your medication falls, you pay a copayment depending on that. So some plans will say, hey, we're going to cover this drug on tier 3, whereas other plans might say, we'll cover it on tier 2 or tier 1. Usually, the lower the tier, the cheaper the price, except on tier 6, which are select care drugs. Those are drugs to treat like chronic conditions like diabetes or high blood pressure. Generally, those tier 6s are also not as expensive as your tier 5 or 4 or 3. But generally speaking, under Part D, you have a formulary, and usually it's a tiered formulary. Also, under Part D, some of the plans are, well, actually, some medications are going to have quantity limits. Those would be things that are like habit forming, where you can develop an addiction. They'll have a quantity limit, so they won't dispense more than like 30 days. And then you will usually have to have like a prior authorization from like a specialist or a doctor. And then they'll also have step therapy. So the step therapy is like because of the donut hole, they have to prescribe the lower cost drug first, if there is one. And then if that one doesn't work, they move you up to the next most expensive one, and then until you get to the brand name drug. And so that's under Part D. Usually, all of the plans are going to require that. There is also what we call you can ask for an exemption. So, for example, let's say you are under a plan, and this plan does not cover a medication that your doctor newly prescribed to you. Well, you ask for an exemption, and usually if there's not any other medication that you can take that falls under the formulary of the plan, they will approve it, and the plan has to let you know that whether they approved it or not within 72 hours. So they can't really, they can't hold you hostage there and say, hey, we'll let you know if it's approved later. You know, they have to approve it or deny it within 72 hours, and they have to give you a valid reason, right? Like, for example, hey, you know what, we denied your request because there is another drug on the formulary that we would like for you to try first before you are able to, before we're able to approve this one. And so under Part D, that's how it works. There is also, under Part D, there is also an income-related adjustment amount. And so under Part D, if you can see, it kind of follows, it mirrors your Part B adjustment. The amount is a lot less though than what you would pay. Than what you would pay under the adjustment for Part B. So there is a adjustment for Part B if you are making more than a certain amount of income, and you can see it on the grid what it is. And there is also a late enrollment penalty for Part D. So when somebody does not enroll in Part D when they're first eligible to enroll, they also start accruing a 1% per month penalty. 10% per year of the national average, which you can see here on the bottom. It's $32.74 in 2020, so like 1% of that every month. And then that is a perpetual penalty, just like the Part B, as in boy, penalty. Now, what are my options when you are on Medicare and when you get that card? Essentially, you have a couple of options. You can see on this slide in the middle, I have the Medicare card, and then on the left-hand side, I have a couple of cards, and on the right, there's just one card. So essentially, one of your options when you have Medicare is you can stick with, we call it original Medicare, and we talked about the Part A deductible, the $1,400, and then we talked about the $198 plus the 20% of Part B. You can stay under Medicare, and then you can sign up for what we call a Medicare supplement. It's also called a Medigap plan. You sign up for a Medigap or a Medicare supplement, you pay a monthly amount for that, and they send you a card, and then you sign up for what we call a standalone Part D plan that covers your drugs. So essentially, under this option, you have three different cards. You have your Medicare card, and you have your supplement card, your Medigap or Medicare supplement card, which essentially the supplement is just picking up the tab for your Part A and B deductibles and co-pays and co-insurance. So you know, depending on the plan that you get, it can pick up a portion or most of your deductibles and co-pays and co-insurance amounts if you have a Medicare supplement or a Medigap policy. And then when you go to the pharmacy, that would fall under Part D. You have another card, which is your standalone Part D card. So with this option, you have three cards and you have three separate premiums. You must pay for your Part B premium, for your Medicare supplement premium, and then your Part D premium as well. So, you know, you can see it, you know, it can get expensive. And then these plans typically are based on your age. So your premium is based on your age. These types of plans, a Medicare supplement, you can pretty much go to any doctor as long as the doctor accepts original Medicare. So, you know, if you're in Arizona, you're in Arkansas, or you go to Washington and you want to go to a doctor there, a primary care physician or a specialist, you can go as long as that doctor is able to bill Medicare directly, and pretty much you would just give them your Medicare card and your supplement card, and they would bill the Medicare, and then they would bill the supplement. And if there's any amounts that your supplement does not cover, then you would pay for that out of your pocket. And then if you need a medication, then you would just go to the pharmacy, use your Part D, your standalone Part D plan, and you would refill your medications. So that's one option. The other option is what we call Part C. Under Part C, you essentially are assigning your Medicare benefits. You're assigning them to one of the companies that offers a Part C plan. Well, a Part C combines Parts A, B, and D, everything in one. So you get one card, and that's the card you use. You no longer use the Medicare card, because essentially the benefit, you're assigning the Medicare benefits to one of the companies, and they have to give you as good a coverage that original Medicare has, or better. Obviously, most companies give you a lot better coverage than what original Medicare has. Now, under Part C, the plans go based on counties. So every county has different plans. So for example, here in Riverside County, we have over 50 different plans that you can choose from. All of these plans are HMO plans, which means that you have a medical group, which is a group of doctors and specialists. You choose your doctor, and then you go, they can send you to a specialist. And generally speaking, under these plans, if it's an HMO plan, you're able to go to, like if, let's say you're on vacation, you're able to go outside of the area, but only for emergencies. You can't just show up anywhere and say, oh, here's my card, you know, treat me. Usually it's only, you know, for emergencies if you're out of your service area where your primary doctor is not, you know, available. But under Part C, generally, you have only one premium. There's plans that have additional premiums, but for example, here in the Valley, most of the plans that are available have a zero premium. The only thing you keep paying is the $144.60 that you pay for Medicare Part B. And so that's what entices a lot of people, because under the other option, under the supplement option, you have to pay 3 separate premiums. Under the Advantage plan, you only pay that $144 typically. There are plans that have an additional premium, or sometimes, you know, they'll say, hey, you want to add dental, it's an additional $10 or $20 or whatever it is, right? And so those are essentially the 2 options. Now, Medicare Advantage plans also cover certain benefits that under original Medicare you don't have. For example, like routine hearing coverage. Like some of the plans will have, like, we'll say, hey, you know what, we're also going to give you, $2,000 if you want to purchase hearing aids, or if you want to purchase hearing aids, if you do, you know, through us, it's only $400 per hearing aid, or $500, or whatever it is. And that's, you know, if you were under just original Medicare, there's no coverage for that, so you would have to pay for that out of your pocket, essentially. And then, so for example, there's also like routine vision coverage, where they might say, hey, if you're going to get glasses, we're going to give you $300 for you to get glasses. Whereas under original Medicare, unless you had a surgery, then if you just want to get routine glasses, then you're stuck paying for those glasses on your own. Some of the plans do offer dental. Some of them offer a gym membership. I'm sure if you have friends, you might have heard them say, oh, I got Silver Sneakers, which is like a program that a lot of the Medicare Advantage plans offer. And it's included in the coverage. It's a gym membership at no cost to the member. And then some of the plans are starting to do over-the-counter allowances, which allow you to purchase or order from a catalog vitamins and supplements, and they give you like an amount per month or a quarterly amount. And some plans also do like emergency non-emergency transportation. So like, you know, they won't drive you to the casino or to the mall or anything like that, but they'll drive you to your doctor, specialist, pharmacy. Believe it or not, there was this lady who used to go to the pharmacy at Costco, and she would come out of the pharmacy. She'd come out with a couple of chickens and a few bottles of vodka. So the driver ended up calling the insurance company and just saying, hey, this lady, you know, I bring her to pick up the medication, and you know, she's coming out with some vodka and chicken. Is that okay? Well, you know, if the pharmacy is there, there's no problem. So, you know, I guess she was having a party after she went and picked up her meds. But there's certain plans as well. If you see on the bottom, it's dual eligible plans. So there's certain people, for example, that have Medi-Cal as well as Medicare. So we call those people dual eligible, and which means that they have both coverages. When you are a dual eligible beneficiary, there's a couple of things that the state Medi-Cal would pick up on your behalf. So for example, like the $144 per month that comes out of the Social Security check. Generally, when somebody has Medi-Cal, the state will pay for that on behalf of the person. There's also, and there's plans that are specific for people that have both. And those plans will generally offer higher like allowances on like vision, like your glasses. They might give you $500. They might offer you other additional benefits. And so that's why there are special plans that cater to people with the dual coverage. There are also plans, chronic condition plans for people with certain conditions, like for example, diabetes, cardiovascular disease. And so those plans cater to those populations where they might, you know, give them like certain medications at a lower cost because they have that condition. And so it's just a matter of, you know, weighing out your options. Again, in order for somebody to be eligible for like an Advantage plan, they have to live in the service area, so like the county, and then they must be enrolled in both Parts A and B of Medicare. The next topic that I'm moving to is the enrollment period. So for example, when somebody's newly eligible for Medicare, when they're turning 65, they have a 7-month window to enroll in a plan, whether it be a standalone Part D plan or a Medicare Advantage plan that includes Part D. So that period of time happens 3 months before you turn 65, the month that you turn 65, and then 3 months after you turn 65. We call that the initial enrollment period. So when somebody turns 65, they have that window of opportunity to enroll. If they do not enroll during that window, then that's when they start accruing that penalty, the Part B penalty and the Part D penalty. The only exception, like I mentioned before, is like, let's say you have employer-sponsored coverage that is creditable, then you are okay. You don't have to enroll in a plan, and you don't even have to enroll in Part B if you don't need to. However, I would always recommend to, talk to somebody and weigh out the options, because it might be cheaper to jump on Medicare than it is through your employer plan, or, there might be more benefits. The next enrollment period I'm going to talk about is the annual election period, which happens from October 15th to December 7th. So we're stepping on the toes of this year's annual election period. Whatever plan, so anytime, let's say you're already on a plan, then, and when annual election period rolls around, you can sign up for a different plan, and that new plan that you sign up for will begin on January 1st of the following year. So that's kind of the time of the year when you hear all these commercials about Medicare. Hey, switch your plan. You don't really have to switch your plan if you don't want to, but that's when you can see, and maybe, hey, somebody else is offering me the medications that are lower copayment, or I have my needs changed. I need to reevaluate. So that's the time of year that happens. Whatever plan you choose, you can make as many choices as you want during annual election period. And the last choice is the choice that kicks in January of the following year. And so the next one is called open enrollment period, which a lot of people confuse annual enrollment with it's now open enrollment period. They named this one open enrollment. I don't know why, but during the open enrollment period goes from January 1st through March 31st. Now, during OEP, what you're able to do is let's say you're on a Medicare Advantage plan, or you're able to either go back to original Medicare and choose a Part D, because when you choose a Part D, if you're on a Medicare Advantage plan, it automatically cancels your Advantage plan and it kicks you into Part D and back into original Medicare. When you have a Part D plan and you sign up for an Advantage plan, obviously it cancels out automatically your Part D plan and it puts you into a Advantage plan. Now under OEP, you're able to, let's say during annual enrollment, you chose a plan and then your plan is effective January, but then let's say you got into this new plan and then during February, you find out this plan was not the greatest thing, or it wasn't what you thought it would be. Then during open enrollment, you can make a one-time election and you can switch back to your plan or switch to any other plan during that period of the year. But you can only do it once, and then you must stick with that election until next year's annual enrollment, unless you have a special election period, which is anytime after March 31st. If you have any special circumstance, then you can make another change. But for the most part, most people are locked into that plan for the remainder of the year. Now, what I was mentioning before is the special election periods. There are certain qualifying events that happen. For example, let's say you retire or you lose your employer coverage, then at that time you can apply for either Medicare, and then once you are active, then you can also select a plan, because it gives you a window of opportunity to enroll when you lose your employer coverage. Or let's say that you were on a Medicare Advantage plan or a Part D plan, and you're going to move from Riverside County to Stanislaus County or San Luis Obispo, wherever. Obviously, there's different plans over there, and so you're able to change during any time of the year, really, if you move, because it gives you that special election period for a period of a couple of months. And so the other one is if you receive assistance from the state. So if, let's say somebody is a Medi-Medi, where they have Medi-Cal, Medicare, this person is able to switch their plan if they wanted to every 3 months. So every quarter they're able to switch their plan. One of the other special election conditions is if you've been diagnosed with a certain disability, like a chronic health condition, like let's say you didn't have diabetes and then all of a sudden you have diabetes, or you develop high blood pressure, then you can actually use that. If there is a special needs plan that caters to people with that condition, you can actually change your plan to that plan during any time of the year if you're diagnosed or if you have that condition. But you can only use that once per year. And then again, like I mentioned before, there's a lot of things, especially for somebody who is going to be new to Medicare, that they need to consider. If you are working and you're going to continue working, and maybe your spouse is on your work insurance, that's going to be something that you want to consider, because if you go on Medicare, maybe your spouse cannot keep their health plan through your job. And so there's many situations. What I always say is, I always recommend, hey, just give us a call, run the situation by us, and at least we can give you some guidance so that you can make the best decision for yourself and for your significant other or for your family. And so that's definitely one of the big ones. If you're still working, maybe you are retired. If you are retired and you are on a retiree plan, you do want to enroll, or if you're in COBRA, you do want to enroll on Medicare, because retiree coverage and COBRA coverage, believe it or not, even though they're the same thing as when you were working, is not considered creditable coverage. And so a lot of people get stuck with a penalty because they say, well, I got insurance, they're paying for it. Maybe the union is negotiated a contract where they're going to keep paying for it, or whatever the case might be. And come to find out, sometimes what happens is the unions change the contract, and then all of a sudden the person is no longer getting that insurance at no cost, and then they have to pay. So they say, hey, you know what, it's going to be cheaper to go on Medicare. So they try to go on Medicare, and then they find out that they're stuck with a Part B and Part D penalty because their COBRA or their retiree coverage was not creditable. And so those are things that you want to consider. And the only way for you to know exactly is, talk to somebody, whoever it might be. Preferably if you want to call me or call one of us brokers, that'd be a good idea, because we can certainly at least give you some guidance. And that's pretty much an overview of what we were going to talk about with Medicare. I know it's a lot of information and I know it's confusing, but does anybody here have any questions, something that may not be clear? Maybe I can elaborate a little bit and make it a little bit simpler, if I may. Does anybody have questions?
Great, thank you, Cesar. Yeah, please, we got 27 people on. It'd probably be easier if you could enter your questions into the chat box. And then if there's something that you want to explain, there's a raise your hand feature. So try that, because I'm not able to see everybody's screen at once with so many people on the call. So let's try the chat feature and see if that works.
Okay, I think I see the chat. Let's see.
Yeah, I see one now.
Okay, I see a question. For someone on Medicare Advantage with multiple pre-existing conditions, are their insurance will accept you without medical? Okay, so under Medicare Advantage, the only question that they're going to ask, and that's for this year 2020, is if the person has end-stage renal disease. When somebody has end-stage renal disease, generally, unless there is a plan in the area that accepts people with end-stage renal disease, they will not accept the person. But for it doesn't matter if you have cancer or if you have any other conditions, it does not matter when it comes to a Medicare Advantage plan. When it comes to a Medicare supplement, now that's a different story. Medicare supplement plans are underwritten by life insurance companies. And so typically when you first turn 65 or when you come off of retiree coverage, you can enroll in a Medicare supplement plan without having to prove insurability. But then if you just want to, out of the blue, enroll into a Medicare supplement or Medigap policy, then they will ask you medical questions. But a Medicare Advantage plan does not ask you any medical questions. And it really, I mean, besides the end-stage renal disease question, and it really doesn't matter if you have any other conditions. I have another gentleman, somebody else that asks, I plan to work after age 65. Do I still sign up for Part B? Again, if you are working and you are getting insurance through your employer, there's going to be certain things that you're going to want to consider. Like, I'll give you an example. Let's say your employer is offering the plan your employer offers you is like an HMO plan, and you're paying, you know, an additional $200 per month. Then, you know, in that case, you know, if let's say you go on Medicare, you're only paying $144, and then if it's an HMO plan, you can jump on Part C, and it might be, you know, lower cost to you, and the benefits might be better than what you're currently getting. But really, I would recommend that if you are gonna keep working, you know, just kind of get an idea of what you currently have, and if you want to give me a call, and I can kind of dissect it over the phone with you more specifically, and I could say, hey, you know what, just stick with your insurance at work for now, or I can say, hey, you know what, it might be advantageous for you to maybe jump on a Medicare plan. So it really depends. Everybody's situation is a little bit different. I got another question. It says, Part C, is it only HMO? Here in Riverside County, we only have HMO plans for Part C. There used to be, a couple years ago, there was a PPO plan with Aetna. They went away from the market. Their PPO plan went away from the market. And then before that, I believe Anthem they had a PPO plan too. But as of this year, there is no PPO plans. It's only HMO plans in Riverside County. You know, like I said, all the plans go by county. So like in another county, there might, like for example, in Northern California, I know there's quite a few PPO plans up there. But again, you must live in the service area to be eligible to sign up for a plan. But yeah, Riverside County, only HMO. I'm turning 65 and Medicare eligible, but I'm currently 100% covered on my company's health plan. Must I sign up for any part to avoid a penalty later? Usually, you do have to at least get Part A, and then you can defer Part B. Just make sure, ask your benefits coordinator, your HR person, just make sure that the coverage is creditable. Which means that it's as good or better than Medicare's coverage. If it is creditable, you shouldn't have any issues if you defer your Part B until you retire.
Hey, Cesar?
Yes.
Hey, real quick, I just want to add to something you just said. When it comes to having to, you know, sign up for your Part A or both your Part A and Part B, especially right now with the Social Security offices closed, it is an online process, and Cesar, if you're, you know, familiar with computers and the internet, Cesar can just email you the link that'll take you right to that page on Social Security's website to be able to start that process, get that ball rolling, at least for your A. And then later you can add that B, and there'll be some additional things you'll have to do to make sure you avoid any potential penalty.
Oh, perfect. Thank you, Brian. Yeah, so again, the next question was along those lines, like, does there need to be a paper trail? Well, you know, once you fill in and defer Part B, they're going to ask you if you're covered for you know, if you're already covered. If you are, then, you know, that's good. And then once you sign up for Part B, they will ask you again if you were insured through your employer, and then they ask you, you know, how long. And so, you know, they kind of confirm, they will confirm that, and then that is how you avoid the penalty once you do sign up. I have another question here. I already have United Healthcare, which manages my Medicare. Do I need to do anything at all if I am turning 65 next January? Well, you know, if you are already on a Part C plan under United Healthcare, It sounds like you probably, you've been on Medicare now for some time. So if you already have somebody, when you turn 65, you don't have to do anything if you are, happy with your plan. But you can certainly, check and see, just to make sure that you are on, the right plan if you've been having any issues whatsoever. Slightly off topic, it says here on this question, if you have time, if you have both Medicare and Medi-Cal, which insurance is the first payer? Okay, well, no, that's not off topic at all. Medicare will be the first payer. Anytime you have any other insurance and you have Medi-Cal, Medi-Cal will always be the payer of last resort. In this case, if you have Medicare, Medi-Cal, Medicare, or even if you're under a Medicare Advantage plan, that would be your Medicare plan, then you would, they would be your primary payer or primary coverage. It says on this one, Part B is 144. Is there a charge for Part A? So again, if you have the 40 quarters with Social Security, which means that you worked cumulatively for 10 years or more, Part A is at no cost. If you have less than that, then you will pay a premium, or they will charge you a premium, depending if it's under 30 credits or between 30 and 39 credits. But if you have more than 40 credits, it's at no cost because you paid for it throughout your life. That's what they take out when you're on your paycheck. It'll say Medicare, and that's essentially to fund, the Medicare Part A fund. And then it says, can I have Part A and still keep my private insurance? Well, I don't know if you're referring to your private insurance as in, like, let's say I've had people where they are going to be 65 and they have a covered California plan. If you have a covered California plan or a private insurance plan that is not through a company, you cannot keep that insurance. It's actually, if you have a covered California plan, you must sign up for Medicare because you are not eligible for a subsidy anymore. If you have private insurance, it's probably better if you jump on Medicare because even if you are paying for it out of your pocket and you're 64, it's probably very, very expensive. But you should sign up for Medicare if you have a standalone individual family policy. And then if you do, let's say you have a family policy, your spouse, or if you have any children under the policy, they can keep the policy, but you would be under Medicare. I don't see any more questions. But again, if anybody does have any questions or something that wasn't clear here, please, you have my phone number, I believe, or I don't know if you were able to catch it. Oops.
It's on the screen right now, Cesar.
It's on the screen, yeah. So it's on the screen here. Please feel free to, give me a call, or I don't know if my email was here in the beginning. Let me check. My email address is right here on this slide. You can also send me an email, and I'll be happy to respond if you guys have any other questions. But it's been a pleasure. It's a little bit different, with when you're in front of the crowd, the interaction and stuff. I really enjoy that. Unfortunately, it's just not the same. I like the noise when I'm presenting in front of a crowd.
You did great, Cesar.
I'm sorry?
You did awesome. Thank you.
Oh, okay. Thank you, Brian. Again, guys, thank you again for the time. I appreciate, for those of you who stuck around, thank you for the questions, and we're here to help. Jeff, big thank you again to you. You're the man. You're the one that makes it happen. So again, really appreciate it from both myself and Brian.
Great. Thank you both. This is wonderful as always and very timely with what's going on right now. So there's somebody's got kicked out apparently. I'm going to see if I could share my screen with a flyer for a conference that's coming up. HIV and Aging Conference. Can people see the whole thing?
I think Cesar has to stop sharing his first.
Let me stop. So I just stopped sharing. Now I can see your.
Yeah.
Now I can see.
So I just wanted people to be aware of this. So the public portion of this meeting, and it's a policy planning meeting. It's not really clear from this, but this is to determine policy for the service needs of older people with HIV. And the public portion will be September 23rd and 25th. And like everything these days, it'll be on Zoom. And there's a link there you can RSVP for. And we'll be sending this out with the next Positive Life announcement. So people will get this out to people, but just want to give people a heads up. So thank you again to both. Any other final questions that anyone has before we go? If not, we'll see you all next month. And take care and stay cool until then. And make sure you get your mail-in ballots. Everybody has to vote this time. No excuses. We'll kick you out if we find out you haven't.
Thank you guys. Thank you so much for having us.
Have a great evening.
Bye now.